During this video, we're going to look at three chronic conditions of fibromyalgia, chronic fatigue syndrome, and postural tachycardia syndrome. We're going to answer the question, are these medical conditions or are just names made up to fit a range of symptoms? What is a CSF link and how does it link to POTS? What is idiopathic intracranial hypertension? How does this link to CSF and fibromyalgia? Are there millions of chronic pain sufferers worldwide left untreated? And all these questions will be answered. Fibromyalgia, chronic fatigue syndrome, and postural tachycardia syndrome. These have been around for a long time. But what most people don't know or realise is they're actually very different than other conditions such as intracranial hypertension, heart disease, etc. So looking at some of these conditions like asthma and heart disease and diabetes, these all have a known cause. If you get to the actual heart of the matter, you can actually cure the condition. For instance, heart disease, solve the problem, control the symptoms. It's as simple as that. Fibromyalgia, chronic fatigue syndrome, and POTS have actually no explanation of what is actually the cause of these symptoms, but the answers can be found here. Now let's take a look at some of the common symptoms found in conditions such as fibromyalgia, chronic fatigue syndrome, POTS, and intracranial hypertension. Now let's look more closely at each condition. There is in fact very little known about the cause of POTS. It's just a theory that there is a drop in blood supply to the heart and brain when a person gets up. There is no clinical evidence for this, neither a reason for it. Here are some of the symptoms of POTS in the orange-yellow colour. Take a moment to just look through and see what they are. Dr. Carroll from Stanford University saw a link between the condition of a CSF leak and that of POTS. So what is a CSF leak? Cerebral spinal fluid, or CSF for short, is the fluid that flows around the spinal column and the cranium. The dura is the wall that seals the fluid in so none can escape. If the dura is punctured, then CSF leaks, therefore the brain is no longer sitting in the fluid but starts to sag. This is called brain sag and leads to a whole host of symptoms. In 2016, Dr. Carroll conducted some research on people that had been diagnosed with POTS. What he found was astounding. Now let's look at some of the symptoms of a CSF leak. Dr. Carroll has a passion for diagnosing CSF leaks and continues his research with the ambition to change the perception of doctors and neurologists so they can spot when a patient has one. In the study, Dr. Carroll found that 60% of the participants had a CSF leak, and when treated reported an improvement in their POTS condition, some making a full recovery. So the question is, should POTS even be classified as a condition? And could there be another answer for the 40%? The answers may well be found in this video. Now let's compare the symptoms of a CSF leak to that of POTS. As you can see, there are a lot of similarities within the symptoms. Some may say that actually POTS is in fact a CSF leak. Chronic fatigue syndrome, or alternatively known as ME, is a condition diagnosed by having a certain number of symptoms. There are no tests or there's no reason for the actual symptoms. The question has to be asked, is this just a way of the medical profession to tell patients it's tough, nothing we can do, get on with your life, trying your best to manage the pain? This could also well explain why so many people throughout the world are now addicted to painkillers such as tramadol. Now let's take a look at fibromyalgia, another condition where, again, if you meet a certain criteria on a list of symptoms, you're put into this group. However, there is an 18-point scale used to aid diagnosis. If pain is felt within 11 or more places, and you have been suffering for around 6 or more months, well, you have fibromyalgia. Next, let's compare the symptoms of fibromyalgia with those of a CSF leak. And as you can see on there, again the similarities are very similar. In fact, there's only a few that actually are slightly different on both sides. We will now investigate that and to see if we can explain a reason why this might be the case. So let's explain the non-comparable symptoms. So nausea, feeling sick, fast or irregular heartbeats. Could this be just a personal response to symptoms? Swollen glands, sore throat, flu-like symptoms. Do some patients have more susceptible immune system? That's just one of the things that this could possibly be. Either way you look at it, the symptoms are surprisingly similar, as if from the same family as such. Could it be that simply the way the doctor writes up a patient's notes determines whether the condition is labelled either chronic fatigue syndrome or fibromyalgia? So let's do what's been done with fibromyalgia and chronic fatigue syndrome. Let's create our own condition. Let's call it CFS Fibro. It's a combination between these two set of symptoms. Have a quick look at our new made-up condition of CSF Fibro and their symptoms. Yeah, no, where am I going with this? Well, let's have a look. Idiopathic intracranial hypertension. This is basically a real condition. It's where a person produces too much CSF fluid, or the blood vessels that absorb the fluid get damaged, so they don't absorb it enough. It's medically diagnosed condition. It is diagnosed when doctors listen to symptoms and send patients for an eye test and a lumbar puncture. If the eye test shows signs of papilledema and the lumbar puncture shows an opening pressure score of 25 centimeters or higher, then the patient is diagnosed and treated, first with drugs and then, if unsuccessful, surgery. Idiopathic intracranial hypertension is the opposite of a CSF leak, where low pressure causes the symptoms. Here it's from high pressure. This puts pressure on the brain. It can happen due to injury or with no obvious reasons at all. Okay, let's have a look at the symptoms of idiopathic intracranial hypertension. So why is there all these symptoms so widespread for this condition? Well, increased pressure inside the nerves irritates the nerve fibres and consequently causes widespread radicular pain. When intracranial pressure increases, drainage of excess CSF through the cranial and the spinal nerves increases. As you can see by the images, it affects a lot of different parts of the body. This is very similar to the pain found within chronic fatigue syndrome, or in fact fibromyalgia. So now let's compare the symptoms of idiopathic intracranial hypertension with that of our new made-up condition, CSF Fibro. Now, as you can see, these symptoms are very similar again, with only a few from each side that are not mentioned. But we will have a quick look at that and see if we can investigate to see if there is a reason why. The first one we look at is swollen glands or sore throat. Again, could this not just be down to a personal factor based on the immune system of the individual? Or it could surely happen in either condition. Flu-like symptoms, again, could this not be just rather a personal factor of the immune system? But however, we will visit this again later because there's something really interesting about this. IBS, your brain controls the function of the bowels. Extra fluid pressure on the brain in some patients may well cause IBS. And food sensitivity. This is probably the most interesting one of them all, and we will discuss a little bit further. So patients diagnosed with POTS generally are told to drink more fluids and increase their salt intake. With a CSF leak, that is also the case. They're told to eat more salt, and this will again help produce CSF fluid, therefore will hopefully fill their head up with more fluid, which will lower their symptoms. Fibromyalgia and CSF both advise against fatty or fried foods or preservatives, and also with high lists of salt in it. Again, what you're looking at here is the opposite. When you've got high pressure, you eat low salt. If you've got low pressure, you eat high salt. There's a definite correlation going on there, and it's again something very interesting. One striking difference is with a patient's vision. In idiopathic intracranial hypertension, we often have vision problems and issues. With fibromyalgia, they tend to not have many actual vision problems. However, they do have reported to have
had blurred vision and different things like that, or eye pain. There also seems to be no mention of tinnitus in in any sort of medical CFS or fibromyalgia condition. However, on speaking to several members who have been diagnosed with fibromyalgia, quite a lot of them reported that they have had tinnitus. So is there a condition that precedes idiopathic intracranial hypertension? Well, yes, there is. It's called idiopathic intracranial hypertension without papilledema. Dr. Higgins from Cambridge University Hospital stated that this condition is classified as rare. It is a milder form of intracranial hypertension with no eye problems and generally a high score on lumbar puncture. But this tends to sort of be rarely diagnosed. But is it rarely diagnosed, and is it generally there quite often but sort of missed? So for our new condition, let's throw out papilledema and vision problems, but let's keep in eye pain, as this tends to relate to light sensitivity. And let's see what we get now. As you can see, quite a lot of links still there, and it is very, very similar. And then there's the symptoms in green that we've tried to explain away during the presentation. So looking at tinnitus, generally it's a ringing or a whooshing sound within your ear. It tends to be either permanent or intermittent, and it has been linked to high or low CSF pressure. Some interesting research would be to link it to fibromyalgia and chronic fatigue syndrome as well. And let's try and explain the flu-like symptoms. So imagine filling up a water balloon out the tap, and you fill it up and you fill it up and you keep going until it pops. So essentially, if you've got too much fluid in your head and on your brain, eventually it's too much, and the dura springs a leak. The leak can actually reduce the symptoms dramatically because obviously it's leaking away. There's less pressure. Depending on the size of the leak, it can really sort of help, but what happens is, where does the leak go? It goes into your sinuses. Depends on where the leak goes. It can go into the ear, middle ear, or through your sinuses. It finds the simplest route out, which is down the back of your throat or through the nose. Both present as either a runny nose or postnasal drip. So you get flu-like symptoms without the flu. A good example of this is the fellow on the screen there called Greg Philpotts, who suffered with a runny nose for 5 years, diagnosed with pneumonia, bronchitis, and it all turned out to be a leak from his brain. How many more people out there are actually suffering like this, and they don't even know what they've got? So let's have a look at the evidence. In recent years, we're talking about 2015 onwards, a couple of researchers, neurologists, Dr. Higgins and Hullins, have been looking at these type of things. Dr. Higgins conducted a study, and what he looked at open pressure scores between 16 and 24 on patients diagnosed with chronic fatigue syndrome, and what he found was, and saying that isn't even intracranial hypertension. Now, intracranial hypertension, remember, is 24, 25 plus. So what he found was that on lumbar drain and reducing the amount of CSF in their bodies, a significant response was found within the patients, and it helped a lot. Hunzer also found a very similar sort of result when he did a test with fibromyalgia and chronic fatigue syndrome. He found the same type of thing, and these sort of two neurologists are the ones that are standing out and sort of saying that high CSF pressure is actually causing chronic pain in a lot of people, even when it's not intracranial hypertension type of highness. The current understanding of CSF fluid levels is that under 8 is low and potentially could be a CSF leak. Between 9 and 20 is regarded as normal. Between 21 and 24 is high side of normal, and 25 plus is high. In other words, potentially intracranial hypertension or intracranial hypertension without papidemia. Some neurologists simply refuse to believe that numbers can be an indicator of a condition, and sort of believe that more 9 to 15 is normal, and even maybe lower than that potentially for some people. 16 to 20 is just a grey area, and 21 to 24 is quite high in definitely some people, and it does suggest that there is a grey area between 16 and 24. So let's see if we can fit chronic fatigue syndrome and fibromyalgia into the continuum. So when we look at, we'll put CSF in 16 to 24 and fibromyalgia in 21 to 24. The only issue with this is that CFS has 3 different levels of intensity: mild, moderate, and severe, which would suggest that it could be in either. So which one do we put it in? Let's look again. Okay, so let's try our made-up condition of CSF fibro. Okay, so 1624, we'll put CSF fibro in. We'll see if that will work. So in the future, if people feel these type of symptoms, they go for a lumbar puncture, they come out between 16 and 24, CSF fibro, there's a condition, we can do something about that. Let's try and get it fixed. Or how about an even better idea, considering there's already a condition called idiopathic intracranial hypertension without papidemia, let's just put that into the 16-24 slot, and diagnose people potentially with that, and see if we can then do something about it and to control the CSF levels, which would then hopefully reduce the chronic pain that people were suffering. In the UK, it is estimated that between 1.2 and 2.7 million people suffer from the chronic condition of fibromyalgia, 10 million in the US, and 3 to 6% of the world's population. It is estimated that 250,000 people in the UK have chronic fatigue syndrome, or ME, up to 2.5 million people in the US, and 17 million people worldwide. The evidence is out there to link it to high CSF pressure, but there's not enough research being conducted, and there needs to be more. To conclude, the incorrect levels of CSF pressure cause a vast array of symptoms. These symptoms share many similarities with idiopathic intracranial hypertension, which is often rarely diagnosed if it is, it's not diagnosed if it's not 25 or higher. And idiopathic intracranial hypertension without papidemia is supposed to be really rare, which, why would it be really rare? I don't understand. Surely it's less rare than idiopathic intracranial hypertension. There are many people, millions of people worldwide, who suffer or undiagnosed forms of this. If the correct treatments could be administered, then people may be able to return to work, get their quality of life back. Sadly, at this moment in time, they are left to suffer, either don't even get diagnosed or get put into a medically made-up name for the condition of chronic fatigue syndrome or fibromyalgia. So what's the treatment for intracranial hypertension then? There's a number of different treatments. We've got, if you're overweight, attempt to lose weight, and this can sometimes reduce the symptoms or even reverse the symptoms. But often people are perfectly healthy weight and get this anyway. There's medication to remove the excessive production of CSF fluids, such as diuretics or acessamide, which is also known as Diamax. People are on that to try and reduce the production of CSF fluid, and hopefully that sort of inhibits the symptoms as much. And people that are on it have found that it does work, at least to control the amount of symptoms. Lumbar puncture. This is already discussed in the research there, that lumbar puncture, to reduce the amount of CSF fluid, dramatically reduces symptoms. The problem with this is that if you have got an issue there, it will just build up again, and you will just, within a couple of days, it will just head back to normal. There are other things you've got, not even mentioned on here. You've got stents, if it's to do with the absorption of the CSF back into your blood. And sort of a last thing, you would go for shunt surgery, which is they basically put a monitor on your brain, and when it gets to a certain level, the fluid gets siphoned off and goes down a little pipe into your stomach. And I spoke to people who've had this, and it's been very successful, life-changing thing. I've also spoke to people who said they've been infected and stuff like that, but generally after a few corrections, it generally works quite well. So there is hope, and I hope this video presentation really helps, because to be honest, it's time to wake up. It's time to expand the research, and it's time to realise that conditions like chronic fatigue syndrome, POTS and fibromyalgia, they have a cause, and it's up to the medical profession to find out what is actually causing it. And I think one of the main causes, and the research is sort of getting there at this moment, is it's caused by either low or high CSF fluid levels. And in fibromyalgia and chronic fatigue syndrome, I would have said probably it's high CSF levels, but maybe it's not high enough to be actually diagnosed as idiopathic intracranial hypertension. And that's my presentation. Thanks so much for listening.